wonder how many people are going to watch these four. Anyway, so is there any public discussion? No. So next up on the agenda is Susan's presentation. I really appreciate her coming.
Am I singing? Am I dancing?
Oh,
Do you want me somewhere else?
Or here, wherever.
I don't care.
How about down there at the end? I think everybody could see you the best there.
Okay. Yeah, I mean, I'm really here just to answer any questions. I feel like a broken record, right? Wave 732 or whatever we're on right now. We're lucky, right, that we live in a county where people understand how important vaccination is. They understand that it's a very low risk, high reward health thing. I'm losing my words today to do, right? Let's see, last time I looked, we were at, I'm going to remember my numbers, 82% of people 26 and older and 73% 12 and older. Those are great numbers. They really are. Now, that's not everybody. We're still that 12 to 24-ish range is that area we're still trying to hike up. We're trying to do some creative things with that. I don't know how much you want to know about that or not. Ellsworth has agreed to have some of these postcards. I don't know if you're hearing about them or seeing them in the community yet, but it's basically a little note for you to send to a friend or family member. I was just rehearsing in my head while I was at my kid's PT appointment when I'm going to write on one of my good friends. I have a really good, smart friend that unfortunately got bad information and is going from that. And I'm going to write her a little note and see if we can't have a conversation because Facebook ain't going to do it, right? So that's how I'm going to use my card. It's just a little note to kind of say, hey, I really want you to get vaccinated and this is why. And then something we're doing in the 18 to 24-ish range with university students, fraternity and sorority life, we're having a contest with those folks to get the most vaccinated chapter. I know it seems a little weird. I bought a trophy that's about as high as I am. It's pretty cool. It's got stars. It's very flashy. They seem pretty into it when I rolled it out. So, some people laugh at these things. We're trying it, whether it gets some attention as somebody learns one other little thing to kind of push them over the edge. That's what we're doing. We think, our libraries and our businesses have been super responsible. You all have. Our recommendations really haven't changed. We get nobody's shutting down at this point, right? We can't continue to do the drive-by stuff like maybe we could before. It's great to see all your signs up about masking. I don't think I saw one person from the door to here that wasn't wearing one. Do I know your staff doesn't want to get into fights about that with people? I do, and I'm glad I don't have to do that. That does not sound fun in any business space. And I'm sure you've got things worked out for it. But so I'm here to kind of give you an update and answer any questions. So before I keep babbling on anymore.
Let me just ask you, your 82% vaccination rate, is that excluding the undergraduates that just returned or the students that are returning? It was a long
age 26 and up. And this is why we do that. We have a hard time.
The staff are a bit.
Yes, they're just not quite right. So we're hoping they're as high as they supposedly look, but let's see, I just got from the university the other day. I want to say 64% are in state, which actually surprised me. It was actually, I swear when I went to school here 100 years ago, it was more like a little closer to 50-50 of out of state folks, but so we wouldn't even have their vaccine records, right? We can't even look that up.
And so we really anticipate that the overall rate, if you walk down the street, is not at 82%.
Right. Yeah. So overall, when you're talking to our overall population, that's 60%. That includes a 2-month-old and an 8-year-old and whatever else. So 60 is still okay, right? We want to do better.
Maybe could you just remark on the trends then, not just the position, but the trends compared to where we were maybe 7 days ago and where you anticipate to be in 7 days? Because I think that's relevant to what we're doing.
Mm-hmm. Yeah, so I know it's disheartening. I think this was already a couple of weeks ago. Maybe you heard at a public meeting, my coworker, Jennifer Miller, who's a disease prevention specialist, was kind of laying the land from last year at this time and this year at this time. Unfortunately, the numbers of infections were very similar. We were getting anywhere from 5 to 15 a day. I'd come in and what do we got today? It's 13. Okay. And now that's some days 35 again. And, we had a 40 day and whatever. So the averages had been, double digits. And now they're, 240 a week or something like that, I think is what I heard them say last. So it's disheartening, right? But we're hoping even some of those people, because breakthrough cases are happening. I hate saying that. I hate talking about booster shots after 8 months. Like it kills me like it kills the rest of you. But, we got to, as we learn more, then we have to figure it out and change our paths. But we're not in the same place. Like it's not quite as depressing, right? Because those people that have been vaccinated, they're not the ones over in the ICU right now for the most part at here or any other hospital around the country. So.
And how about testing? Is it, to your knowledge, readily available or?
Yeah, it's so, the state's not doing their sites anymore. I'm glad we live in this county because we had so many options for testing and, I guess I probably shouldn't toot one place's horn more than another, but I can't help it. University of Iowa, they were always so quick. Their results were always back so quickly. And that's what my family and I chose to do every time we needed to be tested. So we do have the at-home kits. They're a spit test. So sometimes, how do you get a little kid to spit that much in that too? But also then you're not shoving something up their nose. So it's like, okay. We don't, if you're sick right now, or you've had an exposure, we really want you to get a test at a doctor, at a farm, get it at a pharmacist, someplace that's doing the swab tests. We really don't recommend those for that. If you want to travel or you've been quarantining and you want to go spend some time with family, that might be a better use of that kind of a test. Or folks that are really having trouble getting them for whatever reason, they're certainly welcome to them and you can get online and order them. You don't need to get that through us.
That's my husband was going to go visit his elderly mother, did, and he decided he would want to get tested before he went.
Yeah.
And they told him that he would have to pay for the test himself and it would be $180. Well, that kind of discourages testing.
Yeah. Where was that
It
at?
was at the university
Oh, because he wasn't actively sick.
because he had no symptoms.
Got it. Yeah. And I think, I don't know if the pharmacies right now are doing more of that, a little more, what's the word? Less expensive, I guess. I don't know. That's a good question, but those are free. You could have gotten one of those sent to the house.
At home.
That's free for all Iowans. Yep. Especially in that case, that's when we would say, yeah, use one of those.
And we get it from you, from Johnson County?
The easiest thing, if you're comfortable getting online and just ordering it through the state, that's the easiest.
I got them in one day.
Okay.
Really?
Yeah.
From doing it on the state
Excellent.
website?
Yes.
Okay.
Yep.
Well, now I'm going to ask you too many.
No, go ahead.
How quickly did you get results?
I haven't sent in any.
Okay.
It was provisional.
Because people have been telling us it takes up to 5 days. Well,
Oh,
if you're actively sick, that's an issue, right? Which, test Iowa one of a couple of days sometimes as well. And so,
Yeah.
I don't know. We're only hearing anecdotally so far what people are saying. So we'll have to keep an eye on it.
They had said it was 24 hours from recipient, but we know that reality can often be different.
Yeah. How long does it take them to get it from UPS? And yeah. Okay. And those are being done, right here in our county too, out at the state hygienic lab. Those people are working their tails off too. I think they're kind of an unforgotten, place that we need to say thank you to too.
Mm-hmm.
I have a question about benchmarking. So you've seen ours and many other places reopening guidelines. Those feel a little outmoded now because we're in a different place. And do you have any suggestions for benchmarks that we should be looking at that we might not be? We had a long meeting yesterday talking about, do we switch to think about staff availability, assuming that staff may get sick and how many staff we need in the building? Do we watch the schools? Use indicators like percent of open schools. We love having a number because that helps us make
So do we,
a clean-cut decision. But it feels like the percent positive, which we used for the last year and a half, just doesn't hold the same it doesn't feel like the same kind of benchmark anymore.
Yeah, well, and the way Delta is surging, right? Like it's just kind of a different beast. We really don't have a certain number. I mean, I think we all, just when you think we figured out one thing, right? Like, okay, this kind of made sense. And now we're in this land again where it's like, well, wait a minute, if the numbers are the same, kids are going back to school. They can't even wear a mask. They can, I'm sorry. We can't even require them to wear a mask. You know, they're not staying apart like they were before. It's like, and I'm not blaming the schools, do not get me wrong, but nothing's changed, especially for kids age under 12. There's nothing that's changed. So
Well, the danger for the kids has changed.
it's gotten worse
Yes.
just because of the contagiousness of it, for sure. But yeah, that's what's tough. So that number, it always moves. And then it's what should we be measuring, you know?
So is it back to sort of a softer benchmarks of we have the supplies we need to think we're protecting?
I do think people should prepare for, I just heard in the hallway in my office this morning, you know, a place that we work with, they just had somebody test positive and we're going through, well, wait a minute, what was the rule again? Like, 15 minutes, if you were in here all day long, and you sat at the end of the table and I sat over here, I might consider that a little different story in terms of, am I a close contact? We say, 15 minutes with under 6 feet away, even through the course of 24 hours. If you shared a drink with somebody, you better get tested. Like there's some caveats, but I feel like people forgot all of that. Now, granted, if you're vaccinated, you wait, watch and see. You don't have to stay home. You just really watch yourself and wear that mask, which you should be doing in public now anyway. So there is a benefit in that respect for vaccinated people, but we're going to see workplaces hurting a little bit again. Yep.
I want to revisit something that you said earlier, because sort of like, we know we're not going to shut down again. Do you feel like that is the message that you're getting? It's not a point that we would go back to.
Gosh, why did I say that?
Because the library director, there is a point where I come to the board and say, hey, I feel like this is time.
Well, I just said it to my own 17-year-old kid. I was hopeful this is a senior year. And I was hopeful, okay, we're going to, things are going to be great this year. And I said, buddy, it would not shock me if a few weeks into this, you go virtual. So I guess be careful what you say. I forgot this was recorded. Oh, I'm in trouble. But, I don't know. We're worried about the schools for sure. I mean, we grown-ups are doing a decent job, right? Wearing our masks and not sharing the same coffee cup or whatever it is. I don't know. You feel it. I mean, I've felt it in the office and you all do too for how long, but those kids under 12 don't have those options. So, and compromise folks and a handful of other folks that can't get this for that. Like, I feel like too, again, we've just kind of shoved those people to the side and, well, sorry, you'll just stay home. Well, come on. So yes, there's more than just kids out there that are at a larger risk. You're doing all the things. I think we all have to just kind of look around when we see things happening, whether that is in larger businesses or schools, and go, do we need to talk again? Do we need to refigure this out?
I have heard of some businesses, small ones, that shut down because, like a restaurant, because the staff is sick.
Oh, yeah.
So they shut down. I mean, if the library staff isn't getting sick, then you put the onus on the public to make the decision about whether or not they want to come in. I don't know.
Well, the big difference there too is, right, with vaccinated folks, you're half your staff doesn't have to stay home that were in that close contact or whatever. But they're, waiting and watching themselves, because the likelihood is less that they're going to get infected, and even less that they're going to get super sick. So I know, not what anybody wants to hear. I get it. But again, this is a more hopeful time. This isn't a year ago where we have tools. People need to use them, but we have the tools.
So I just want to make sure that, so if I have a staff member that calls me and says, my husband tested positive, but they are vaccinated, they can still come to work.
Yep. Yep. We don't want them, we call it be hyper vigilant about any symptoms. Would I go visit my nursing home, aunt or something? Probably not until those 14 days were up. If I had a scratchy throat or just any little thing I'm not going to say that's allergies. I'm not going to say it's a cold. I'm not going to say I'm going to keep my buns at home. So that's the kind of the difference, just super hyper vigilant about it.
Do you have any opinions about deciding? We do a lot of outreach and we do a lot of programming at the library, and a lot of that programming is for youth who aren't required to wear masks if they're under 2, but we know they're also not vaccinated. We're having it's a complex decision to make about whether we let the community decide, and if we have staff who feel confident and comfortable doing those programs in person, whether that's the right thing to do. And the same thing goes for outreach, which often involves vulnerable population, children, seniors, people like that. Do you have any comments or any guidance about how we would help make that decision?
I do. This is the one thing, I'm glad you brought it up so that I didn't forget. My coworkers would be upset with me. They said, this is the one thing you should talk about. How do I say this? You want to mitigate what you can mitigate, right? I get that you want to get people together, right? And that these programs are important or we wouldn't have them in the first place. But you need to think about the amount of people in the room, masking or not, their ages, and how big that room is. Did I already say how long they're going to be there? I think I did. Oh boy. You have to have the whole package and then decide if it's worth it. And now that, can I give you an opinion on? I think we've all personally had to do that for a lot of different reasons. But then, on the business or the organizational side, how key is it to how much do those people need that service or need that activity or event? It's different, a little different when it's outside. It is.
So do you make recommendations, no eating and drinking in these programs?
That's best. Yeah, the minute you take off that mask, that is one easy thing to kind of cross off the list that we would recommend, yes.
Robin, I didn't hear your comment.
I said, would you recommend no eating and drinking?
Oh, okay.
When people take mask breaks? Because you said people congregating together without masks.
Is the county tracking vaccinated individuals that do test positive?
Good question. I've been asking that too. So I'm always the person that wants to put out more information and more numbers all the time. And how do I say this? Somebody's tracking it. I don't know that we have it in a form that somebody can dig through it and that I can, as a communications person, then say, here's our number. But it is something that we're following closely and that I'm pushing us to put that out just because I think a lot of people want to know that. I really do. But then also, how many of those are asymptomatic? How many of those people just had a headache for 2 days or so then you have to have all these qualifiers or people are like, oh no, everybody that was vaccinated's got COVID, which isn't the case either. So it's hard to paint the story accurately and we're trying to figure that out.
I had just seen New York had been releasing figures that are surprising. It's still yes, not in hospitals and not reinfecting, but that it is going up, which I guess for operational purview, it's sort of you just don't have it, you can't come in.
Right.
So staffing levels.
Good point. Yeah.
You're still safe, but
right. Yes.
maybe not for your family, are you safe?
Yeah.
I do think there's still a little bit of a feeling of invincibility that comes with the vaccine for some people, but I feel like it was a real turning point for some staff to say well, no, now I can do in-person programming. I'm vaccinated. I'll wear a mask. And I think as we pay attention to the breakout cases and the variants, I want them to feel confident and safe and protected, but there's that line of, but you're also still at risk.
Mm-hmm. Yeah, I don't like that part either. I'm very confident and comfortable knowing that, if I get this now, where that wasn't the case before, that I wasn't going to end up with the U. So that makes me feel better, but I don't want to be the person that passed that on at work, and hopefully we won't. We're doing great with masks too, but it can happen.
I had a question. I'm gonna phrase this as narrowly as I can. I know that at a state government level, they've done their level-headed best to prevent any type of requirement around the vaccine. We try to prevent that actively. So from your experience thus far, maybe even this week since the FDA approved Pfizer fully, is your experience with it thus far that that's effectively a non-starter in the state of Iowa? And I know that that's a really loaded question, but. And it's okay if you would rather not answer.
Private places can still do what they want, right? So I do think you'll see a movement like we have around the country of people requiring it, and not just in healthcare. I think in other businesses. Those of us that work in government, I don't see any hope for that, but that's my personal opinion based on what you've all watched, heard and read as well as I have.
Okay. I just wanted to, I know where my head's at and what I understand it to be, but I wanted to.
Yeah. And there's, vaccines are required in schools. Heck, I'm required as part of my job in public health because part of my job too used to be doing some HIV testing as well. So I was handling blood. So I had to have, hepatitis A, B, what is it also? Shame on me. Tetanus? No. TB. I had to get TB tested every so often or whatever. So, there's already stuff that we have to do and have to have. And I know that people for whatever reason, have a hard time seeing this differently, but those requirements already exist in certain places. So.
Sure. Okay. Thank you.
I have a question for you. Maybe it's not regulated, but the sewage testing that we're doing is only coming from 2 dorms and not the entire campus or 2 dorms. Is that, or they're only doing 2 dorms as a sample? Is that true?
I don't know anything about that yet. I mean, I probably just heard like you heard. And what is it, a Des Moines?
Des Moines doubled their sewage rates.
Well, and
COVID. Yeah.
I remember hearing.
They went up in 2 weeks to double. Yeah. But I just wondered what the science was behind testing only 2 dorms and not.
No idea.
A site that's got more than just defined residents.
Yeah, if it's some logistic thing,
Yeah, right.
that's what works easier for them, who knows? But I wonder when they'll have that out. Oof, yeah.
Other questions from the board or the staff?
I wish per usual, I could say this is exactly what everybody should do. And we know some of those things and you all do those things. Past that, I understand the spot that individuals and families and organizations are under. And I don't envy being on these kinds of boards and school boards and all the decision-making bodies. I don't envy any of you. And we know you're all doing the best you can.
Your feedback throughout the process has been really helpful. We appreciate it. I'm sure we'll have more questions.
Yeah, anytime. And let me know how this postcard thing goes. I'll try to get you, if you run out and people are using them, I encourage you all to at least look at one before you leave. And hopefully, unlike me, you don't have a very good friend that is still a holdout and you don't need to send them a card, but you could try it because being nasty doesn't, I've tried it. I'm not embarrassed to admit it. It doesn't work.
Wish you did.
If I knew it did, man, I would just be barking orders at everybody. But
Given my arguments.
it doesn't work in my house either, so. Okay, everybody take care.
Thank you, Susan.
Yeah, good to see you in person.
Yeah.
It's slim, but I think we have a quorum now.
Yep.
It's a whole new world that I'm in now. Things very weird. This is a few people, but anyway, I think for the next item on the agenda, which is to review the 4th quarter statistics and financials, maybe Derek, you could pass those things
Yeah.
around. updated one.
These were sent, but
Actually, while we're at it.
The document that was in the board packet originally, the numbers were accurate. There were just two complex columns that we were missing, the third quarter and 1 month, and no, 9 months and fourth quarter. were missing. But the numbers that were there were good.
Oh, yeah, I just passed them around.
Oh,
It's all good.
there's so many left over.
I know.
Jeez.
It's fine.
So, I don't know, Ellsworth, you want to go through these?
I don't know if people have any specific questions. Going through them, I felt like they were, I mean, I'd say the curves are what we've been seeing all year. I don't think there's anything on here that's going to be shocking. Obviously, the big turnarounds are things that we just hadn't been doing until right now. Some of that, like some of the school outreach and the daycare numbers and things like that, you'll see have a sharp return. But otherwise, I think this is probably what most of us would have expected to see coming into the end of the year. Unfortunately, I'm not confident we'll see the curves continue to correct because of some of the pulling back on outreach and programming that we were looking at. But this is where we landed for the year.
Can I ask you a quick question?
Yeah.
Can you give us or indicate any measurements that are totally different from the patterns you've seen with other libraries in Iowa?
Very good.
Are there any outlying numbers that are different than the general patterns we're seeing throughout the state? Is there anything distinct about it? Because I'm thinking a lot of these are just the proofs of the current operation. Is there anything that's?
Yeah, I would say the short answer would be no, but the longer answer would be some libraries or library districts, like committed at the beginning, we will be doing X through COVID. And so their number of daycare visits may not have varied as much, but I think most of us have had sort of the holistic, like we're going to do the services we can safely. I think that this is going to be a similar curve. And then, you know, many of the smaller libraries just had to stop doing. I mean, many of their numbers will just be zero for most of the year. We'll really get a chance to see that in more detail after the state annual report is done. I think this is going to be a fascinating year for that. We did just get that document. I was pleased to see they didn't change too much, so we should have a decent year-over-year comparison, but that will speak a little bit more directly.
Here's your second question, then. Is there a possibility that this drop in usage numbers will threaten any of our funding on the state level? Or will they be interpreted as a blip?
I think they'll be interpreted as a blip. And I would feel differently if COVID had been regional or this was a reflection of building failure or something. Because everybody's going to have those probably similar ratios. I can't imagine that being used against us in the state.
I'm just thinking of the arguments you hear at times that libraries are becoming antiquated and not understanding the range of our services.
I think
this will be data that could support that argument if misinterpreted.
It's dangerous data for sure. I mean, especially when we move forward and people might forget what really COVID and the state library has not brought forward any concern. ALA hasn't really touched that yet, but they might. I hope Sam might know more about.
We are expecting additional funding for IMLS, and so states will get a little boost in the arm and be encouraged to support their libraries.
Well, that's the other side of the pendulum. Maybe it's a positive to to promote investment. I don't know.
I think one thing we have to watch carefully is how the digital versus print, how those regulate, because they're, I'm gonna say correctly, they're reverting more than I thought they would. I thought we might have just seen those digital numbers continue to climb as people got more comfortable and into that pattern, but there's a little bit more swing back than I had anticipated. So it'll be
It's kind of weird.
curious to see moving forward, because if it doesn't sort of continue a little bit how it was, we may be in a position to be repurchasing print copies of things that last year the demand was for digital,
Right.
which could change that landscape just a little bit.
I could see that.
That was my number one thought was, are we doing everything we can to make sure that people are comfortable and continuing to use the digital service? And can we continue to drive those numbers and improve them? And I was disappointed that they tailed off a lot. And I wondered why that was happening.
Well, my digital use is probably down like 90%, so I can start borrowing again.
Okay.
I'm part of that number too. I did it when I thought it was safer, and then once I learned it really probably didn't matter much, I went back to taking out the hard copies. But we'll have to see how it settles. It's a little too early, I think, to start making changes. Luckily, there are some really great tools that our collections department uses to keep a close track on that, to really be able to go back historically and say, these are the reasons why we bought this number of copies in this format versus this. This is how we evaluated it. This is how many were weeded and when. And so it's a great place to be watching, because the statistics are so closely kept. But I agree with what you're saying, Dan. I think we have an opportunity to push, the reminding people that
Further
educate there and
Acclimate.
to say,
That's kind of what I'm thinking is, folks out of desperation jump there. And then when they felt comfortable coming back to the library, they said, well, that was complicated. I'm not going to do that. And I love holding a book. And we need to get people to say, that online service is every bit as good as a book. Somewhere in the stuff I read this week, you said that the digital is more expensive.
Far more expensive.
Far more.
But if the usership is high, and if the turnaround time, people are finishing their digital version more quickly than the physical version. The book version.
I don't think they do, though.
No,
I think
then we get our money's worth.
But I think there are still multiple types of purchase where some digital purchases can only serve a certain number of times and then they go away. So we have to repurchase. Some are forever and however many. Like there's some that we just buy, but we have kind of.
That's becoming less and less of
Okay.
a thing. Yeah, publishers have moved over to that gated access because they make more money.
And they can argue that if you buy a print book, you won't have it forever. It gets used, it gets damaged, and then you buy it again. But it is
Like a fight them about.
it's a great thing to read about. It's a great topic to read on.
It's a tricky situation.
Yeah.
But it's, I think your point was well taken. We should remember to keep promoting the digital collections with the same vigor that we did during the shutdown.
I do think that you can't overlook well, for me, it's a thrill of coming into the library and browsing the shelves. And, to get a digital book, I'm going to need to basically know what book it is that I want. Whereas, if I come into the library, I'm likely to leave with 4 or 5 or 6 books. I'm not going to do that with a digital book. I mean, it's just a completely different experience. So it doesn't really surprise me that once the library opened up, all of a sudden, the print format is more popular because.
Browsing is very difficult to reproduce.
And it's fun. I mean, who doesn't love to go into a bookstore, even in the airport? That's the best part of being in an airport. It's finding a bookstore, for heaven's sake. So that's my 2 cents worth.
This year will be us kind of recalibrating and rebalancing that. We're not sure where the chips will lay because there's also issues with accessibility for materials. There are a lot who do not have access to the internet. or may not have.
Right.
access to. So we have to ensure that we have the same breadth and depth of the collection that we do online.
I'm just concerned that we're going to get back to the place where people are too scared to come in and browse the shelves.
I don't know, my kids aren't scared, but,
Has,
and they're not scared of digital either, so.
We'll adjust those numbers.
one thing I'm curious about is have you noticed any movement from publishers in the way of access and making access to these digital materials more equitable, considering COVID? I'm sorry, it's just, I'll be blunt, it's offensive.
It's a for-profit model.
You're right.
Yeah, it's a private for-profit model. It's not a humanistic nonprofit service.
Library.
You're right.
It's what
Right.
it is. I totally agree with you, but I also look at their model and say like,
Really appreciate your
they have the
pragmatism. on
right to do
that.
that. And we have a right not to buy from them.
And part of the irony of that situation is often the digital ebooks and others have so many amazing accessibility features for people with disabilities, as small as dyslexia or needing to have a larger font. I mean, there's such an amazing array of just kind of default built-in accessibility features, and then to have the cutoff be essentially the new version of a digital
Yeah.
guide. It's,
To me, it's like putting a book about mobility issues at the top of a stairwell. It doesn't make any sense.
There were a couple of examples, just for recording, there was a couple of examples of publishers providing either free services or better access to things. Ancestry is an example. Ancestry was a resource that you were only allowed to use in-house during the pandemic, and right now, we continue
Through June.
through this June. Yeah, they offered it offsite so people could see that. Overdrive offered a variety of Duke classics, which were all in the public domain.
Right.
But
it's not nothing. You're right.
But some, so we.
Okay, are there other questions about the circulation statistics?
And some of the numbers are kind of surprising, but the total circulation is down 15%, which doesn't seem that
Painful.
painful, yeah.
Right.
I agree.
Yeah, I think it could have been a lot worse.
It could have been a lot worse if you hadn't offered the programming you did,
Mhm.
the pickup services and the.
Mm-hmm.
Yes. As an organization, don't view that as a net negative. I think the reason, like you said, it's not worse, it's effort from everybody.
Okay, so let's move on then to the expenditures of the financial reports. I didn't know, so I asked, and we need, the board should accept this report or not accept this report. So we will take a motion to accept it after we, unless there are questions, or Ellsworth, you wanted to point things out about, you wrote a report, right?
Looking at,
How deep into the packet is it? I'm not seeing.
It's after the circulation.
Page 21.
Okay.
Of the,
20.
Oh, and he wrote
yeah,
budget items of
Here we
note.
go.
so when I looked at this budget report, as somebody pretty intimately familiar with it, it sort of felt like, what do you talk about when everything is on that? But the number, so few of those lines balanced, and what I was hoping to convey with the memo was as sort of, well, as it looks. I wouldn't want anyone to have the impression that that was like an intentional spending. We track our spending incredibly closely. So every time that we expended from the mail line that it was overspent, we knew that. So we were making those decisions consciously. And we then tried to balance, okay, so if we're overspending here, where can we pull back? So I pulled out mail, that one we talked about a lot at this table, so that I don't think anyone is surprised there. Just going through those savings on the things that we deemed unsafe for our staff. So we weren't sending people to training offsite, things like that. Pointing out that the collections budget, which appears to be overspent, again, that was an intentional, that's a reflection of an $80,000 reduction that was just put there by finance, and we chose to overspend and absorb it elsewhere. I don't think it's a surprise to anybody to see cleaning and PPE lines understood. And then showing a little of that ripple effect from format changes in what folks were reading. A surprising comment I got while we were closed was sort of like a elbow in the ribs of like, well, you must be saving a lot having that building closed. But no, we are not saving anything. We're building full of paper. You can't turn the heat of the air conditioning off. We have to keep it at a regular humidity level, temperature. So, but I mean, it might be slightly surprising to see that we overspent some of those facility lines. I talked to Brad quite a bit about Brad Gerke, our facilities head, about why those lines looked really good. And he said it's just a combination of we had some real cold days, we had some really hot days. We also were using an atypically open part of the building for curbside. So for the building to, to shove that heating and cooling into the essentially stairwell that we were using to get out to the vehicles, that took a little extra energy. And similarly, for like the heat curtains in the lobby to function, which is a very key part of our overall HVAC system. When we were doing lobby-based services, there were times when those doors were open almost all the time. So it's sort of those pieces add up. They add up to the energy costs, but again, because we are so able to track as we spend, we didn't. It's not that we got to the end of the year and thought, oh, what a surprise! We're over. We've known that since the the beginning of winter that we'd be over. And obviously recognizing one of the reasons we had so much flexibility throughout the rest of the budget was the cost savings of having a furlough. That would not be something we choose. That wasn't the intention of the furlough, but having that particular line underspent the way it was allowed us to take on some other kinds of service work. And I think looking at this budget overall, I think it's a pretty fair reflection of how the year went. We had plans, some of them worked, some of them didn't. We had new ideas along the way. And we also wanted to be very conscious of being a team player. So when there was an opportunity not to spend out a line, instead of finding something unnecessary or surplus to burn that line out on, we chose to not do so and end the year with a higher balance than we typically would have. I'm hoping that next year we'll start to look a little more traditional. We'll see what happens with the pandemic. And I think this year gave us a nice blueprint. If we do go into any kind of similar service changes or building closure, we hope none of that happens. But now, instead of going into mail service or curbside, with really no idea how that would impact the budget, we have a pretty good idea. So we'd be able to future cast those costs and that schedule, I think, with a lot more accuracy. And I wanted to give a lot of credit to the leadership team for coming into this year, we had an extremely traditional budget. And I look at Andrew's department that was able to convert what we had planned to spend on outside presenters and large programs and turn that into take-home craft kits and things like that. And just the amount of labor and material that went into some of those different creative approaches helped us continue to serve the community without overextending the resources that we had. So the group just did an exceptional job. Yeah, we're happy to answer questions. I know it's kind of like, where do you start with it? It's all kind of messy, but
Robin had a question.
First, I want to ask, who's this report going to? Will it be going to the city? Or is it only an internal report to the Board of Trustees?
just for you. I mean, the council will see it in there when they see the award packet.
The reason I ask is I think some of the verbiage you might want to reconsider, like, I don't think these are over and underspending, they are reallocations or redesignations. Because over and underspending sounds like it was not a purposeful decision. And I think also when we're talking about facility use, I had questions about facility use until you spoke just now about the fact that we opened a large area for outside pickup. I think just a sentence of those details and how the facility was used differently, because you speak of the fact that building is still operating, we still have electricity, but the reality is we opened different doors and we used it differently in order to make the accommodation for patrons. So it's more of a purposeful budget use than just saying, because I think when you first read this, it sounds like, we're over, we're under. It's like, no, this was an active decision by the leadership group to adjust services.
Okay.
And the cost reflected. Does that kind of make sense? So it doesn't sound like, it sounds like there's still.
It's deliberate.
And it's being driven by a service model.
And I actually thought about what you're saying and said over underspending, because in my budget experience, you say reallocation when you actually reallocated the funds within the general line.
Yeah, but
Well, I
you
agree
kind of
with you. I
moved
agree with
things.
you.
You reallocated from one line to another because you had the money and you had a greater need.
Yeah, I think that's a good idea. And it would be a simple change. I could just edit it.
Or at least if the document is to go public in any way that it,
Yeah, we could just change it.
internally, I mean, we all know what you're saying, but.
And I never would want to give the impression that it was, flippant spending or not.
Right, no, right. And when I hear you speak of it, it's a very different feeling to me, at least, that these were active decisions to reprioritize the use of some of the funds. I'm seeing like when Teddy has to use this for donors, or we have to use it for the city council. We want to frame what they hear.
It's certainly a public platform. Anybody can.
Right.
Yeah, that's a good idea.
Because actually it's a positive thing.
Yeah.
Other comments? So I don't think that we need to approve Ellsworth's introduction. I think we need to accept the reported financials for the fourth quarter. If somebody could make a motion to do that.
Seconded.
Do I get to vote? Then we don't have a quorum.
Yeah,
You vote.
quorum.
Yeah, but you vote.
Oh, okay.
Yeah.
We don't have a voting quorum. All right. All in favor?
All right.
Those opposed? Okay.
Here's one more question. I'm sorry, I'm a little bit slow on that. But on your salary savings, was that partially because of, part of that also due to the retirement of very senior staff members? And we might say that we had this long tenure of staff that retired in a cluster, which adjusted our salary structure overall. Does that make sense? It's just, I think everyone in Iowa City knows that we've lost staff retirement. But those people have been here their entire careers on a different salary structure, the people entering those positions, and adjust that line along with the numbers that we have.
Okay. Moving on to the end of year report for fiscal year 21. Are there comments or questions or? I think it's pretty much the same, right? It's the fourth quarter, so.
Yeah, different kind.
Except for the. Okay. Strategic planning update. I think did everybody get a copy?
You went out, but also hard copy too.
There's been some discussion about taking a look at the strategic plan updates quarterly rather than every 6 months. And Ellsworth didn't seem to indicate that that would be a lot of extra work because the leadership team is always working with the strategic plan in mind. So if the board would appreciate that, I mean, I personally think it's a good thing. It's sort of it's easier for me to remember the goals over 3 months than 6. So with your permission, I think I'll ask that we do this quarterly rather than.
The cube, we're 1 year into a 3-year plan. I think that on many of the goals and objectives, we are kind of where we thought we'd be, especially when we know about COVID. It's not a typical year, but I think that we've made good progress. Some of them really do hinge on being able to interact with groups of people, which we were hoping to do in person. Some of the community feedback groups, things like that. If we get too much farther into this year and it doesn't look like it's a possibility, we'll probably shift that vision and try to do them virtually. But we really, some of these were sort of intentionally left because we were hoping to be able to engage in really in public face to face. We'll just have to keep evaluating as we move forward. And yeah, we try to just sort of give as clear of an update as possible, but we're happy to answer anything about specific items or the plan in general.
I just had a question, not that it's under goal 1, objective 2. It said RFID pad installed at info desk. Does that mean you can check things out? Is that what that means? Upstairs? Oh.
We're still doing training for that, so we don't have the time to do it. Those who know how to do it will just sort of tackle it as it comes up.
Okay.
And that reduces the number of people who have to be sent downstairs to fix the problem on the self-check or something. So.
We also have the self-check right there really often. So if the staff person isn't trained on using the module of the desks.
Okay. Any comments? Just for an off year, there's a lot of projects made. Well, hopefully this is our last surge, and once we get through this spell, we'll be able to really get going. Other comments? So then the next one is the policy review for the circulation and library card policy. And I believe that's just one voting to approve what the board already decided change. Are there other, as people reviewed these policies, this policy? Are there other comments? I don't believe there were any other changes made. So.
The only thing as I was reading through this, I'm wondering, why would I ever think of calling a library if my wallet was stolen? I'd be calling my credit card company. I never would have thought of calling the library. my wallet was stolen. So, the idea that I would be responsible for material borrowed from my lost or stolen library card, I was dumbfounded by that. One thing I thought is, if my wallet's stolen and I come to the library and get a new library card, does it automatically disable my prayer card?
Yes.
Good.
So that's the one who had it happen, yes. It wasn't so I was lost in, like, one of the first things I thought about was chances are I lost it in the library.
I had the unique experience of losing my wallet in the library.
Right.
And the library staff was amazing, and you wouldn't believe the cameras in this place. They're everywhere.
So go cardless.
The last thing I would have done was call the library if my wallet was stolen. Absolutely the last. I was dumbfounded when I was reading that.
Yeah,
For you, I think
So had
the limit.
Yeah, my husband gave me it.
Right.
Yeah, I know.
my keys.
Most of us are cardless, yeah.
Yeah.
Just my phone.
We
Okay.
entertain a motion.
Yes, can we have a motion then to approve this policy as presented in the report?
Moved.
Second.
All in favor?
Aye.
Opposed? No? Yes.
You must have really good hearing.
Instead of voting on behalf of John.
I knew there was something on that end of the table. And that is proper.
We had a lot of discussions on the pros and cons of this, and the best intentions, they've just been a long discussion. But all my remark relates to
Every month.
Yeah,
for years.
Okay, so moving on to staff reports.
I feel like I don't hate to present things that aren't super positive, but I think it's important to have a record of the attention and work we're trying to do around staff morale and COVID. Aside from this being a life-threatening virus, one of the things we talk about the most is how do we keep staff engaged? How do we keep everybody up to do this public service work? Especially when there's the oscillation of masking and not masking and those things that happen without a whole lot of advance notice. So one of the things, it's not in this report, but as we think about our training and learning curriculum for the year, which has been so enhanced by the support of the NOBU expenditures that this board is supporting, that really we are going to put some very intentional effort into rebuilding the morale, the connections, getting staff back to feeling like this is where they want to be. And despite COVID, library work is where the heart is, and I'm trying to get back to a better level of that. I'm not saying that people are crawling in off the street in misery, but there is a palpable difference. I think that the stress, the fatigue is just a real damper. But we've got some ideas. We continue to do small but sort of impactful things of, when it's safe for eating pizza or celebrating different things, and even just those small things I think have an impact. And we're all anxious to see what happens with the mask mandate. We're gonna hold on to it while we have it, and if it goes away, we will reevaluate. And this is the big one, the board annual report update. After last month's meeting, where we had quite a bit of back and forth about how we wanted to work this document, I was able to verify that it is no longer needed by the city. And Carol and I talked, and we agreed that there's really no reason to finish it as it stands. Instead, let's put that energy into creating a new format for the board to have an annual report that actually speaks to your feelings of achievement and aspirations. So I'm sure there'll be great ideas about that, but for the moment, we will be putting that document to bed. And I think that that's a positive because going back through previous packet years, it seems like it always was a little bit tedious. Otherwise, just sort of the general updates. We did decide to postpone the board recognition dinner after sort of some disappointing exploration of what was available within walking distance. Many more places to be charging a minimum to use the space or surprisingly high rental fees, like $1,000, things that as our size group, we probably aren't the best fit for. So we're going to let it go a little while longer. We're still committed to doing it, but we want to make sure we're finding somewhere that reflects good stewardship and lets us take the safety precautions that we need to take. And I appreciate the strategic plan conversation earlier. We'll go ahead and do that. Any questions about the report or anything else that happened?
Has there been pushback in the last week since Mayor Teague's mask mandate?
Not much. I would say I've heard of a small handful, like maybe under 5 patrons that argued about it. We have a lot of masks on the floor. So I think when people come in, they're kind of on the fence. I think that alone sometimes spurs them to like give up and put it on. I haven't been called to deal with any specific. I don't know how many things have elevated to the coordinator level, but I was shocked that there wasn't more pushback. I mean, I was prepared to have a special meeting. I was prepared to think about security options. I really thought it was going to be a hardship.
Well, we were being targeted apparently
Right.
when we relaxed them last time, and so apparently that's not happening.
I mean, I don't know if it's the mandate just has bigger teeth than I expected. But I will say the half measure of before the mandate, when we were saying we are requiring them, but we also aren't kicking you out, but we won't serve you, seemed to work pretty well. I think staff were pretty comfortable with it. And I think it did resonate with patrons because we would see the pattern of refusal, that's fine, I'll go do my stuff, and then sort of sheepishly putting one on when they need help with the printer or something like that. And we're never attempting to shame or guilt people. It's just, this is our baseline defense that we have against the pandemic. And withholding that service is the only leverage that we have to get people to onboard with it. So, but I think I felt more comfortable with that in practice than I maybe anticipated. So if the mandate does go away, I can imagine us doing something similar.
Other comments? Okay, departmental reports, children's.
Do you have plans if the book festival we do for children in the fall is have to go virtual?
Which one?
It's got the one book or
It's
the one with the
in,
children.
February.
Oh, it's in February. Okay, I've got that mixed up with the human rights one. Okay.
I'm not sure what.
No one can see February.
But there is one in the fall. What's
Or no,
That's what I'm saying, the one book, two books, that's the February.
just the regular book fest is in October.
Right.
And it's half hybrid, moving more to.
More hybrid. Okay.
Now made it to almost 32,000 books for 125,000 goals. So please keep adding those in. We have, and if you haven't completed the summer reading program, it goes until September 1st, and we have a lot of adult books a lot of children's books, if your grandkids or young ones, read the 10 books to get your free book because we have a lot to give away still, so
Still got this week.
get this week's.
We just gotta get Hannah to get all the books out virtually.
Yeah.
We have postcards. Send it to your neighbors.
When it's virtual, you don't, or when it's an ebook, you don't know how big it is when you check it out. So I've been checking out gigantic books.
I feel a little embarrassed when I.
Yeah.
I got 40 in, I'm sorry.
I just listened to a 49-hour audiobook.
Oh, my God.
Oh, man.
Okay, that's,
Now I'm listening to a 29-hour audio.
We have some recommendations of several.
we might know some appointments.
You save those for car trips.
Or prison.
I did 19 hours one weekend and didn't finish it. And I was listening to it on 1.75%.
Well, even if you tried speeding it up.
Yeah.
You said she was at 1.75.
Very slowly.
So that's why I'm not able to read any other books. I'm reading books that could easily be 10 books.
You put one title in 10 times.
Just falling asleep and having to do it over.
That's right. You could put in each chapter. There you go.
I would tell parents for every one of those, there's Go Dog Go.
Message received.
That 125,000 book goal. So, and then along with foundation, we have the 125 birthday bash, right, that you'll probably talk about. Okay.
Well, it certainly is not the same in the summer during a pandemic. I mean, because it just was so crazy in here typically in the summer.
It's very, very slow.
Yeah.
Kids back in school.
Can't wait to have them
Very
at it.
slow between 11 and 4 o'clock.
Okay, collections.
Talked a little bit about the statistics. I'm happy to answer.
I love the little dot of fiscal year 22.
I know.
It kind of gives you like a
It's
sense of
cute.
optimism.
Yeah.
for the new year.
We started.
Please end.
Well, okay, and IT.
I had someone ask me about the app situation, saying the app is really difficult. We're accessing things now because you can't just pick it up in the general. Like go into an app place, download it, and they can't find the site on the library website anymore to download it. Is there something we can do just to make it a little more visible to users? And maybe it was someone who's just challenged. I'm thinking if someone brings up saying, I used to use the app, but when you updated it, it no longer was available. It was new improved to a point that's not accessible.
Maybe they're looking for it in the app store.
Right, where we used to get it and stuff, and like now it's just like one more step or something that.
Well, I had never downloaded the app before this, shoot, sorry.
Could be any of us.
Before you announced it on the website that it was new and improved, I really like it, but I hadn't done it before, so.
I'm seeing some people, for some reason, they're not finding it as easily as they do. And it could just be, the outlier who says something. So it could be that you don't want to generalize it, but it's,
I mean, I think generally it's much easier
once they get into it.
to install it. I mean,
Yeah. It works nicely because now you can see like when your holds are expiring and stuff, which was always a challenge in the past, but.
I haven't downloaded it yet.
It's a little trickier because it can be browser dependent. Now.
Yeah.
If you're using Safari or Chrome or some other thing like DuckDuckGo or something on your phone. But that first time, you might need staff intervention, but otherwise it should.
Right.
Okay, and Patty, you report.
I too would be happy to answer questions about, it is great to have the bookend volunteers back for a few hours every day. And I'm sure hope you'll be able to join us at this point. We're still a go for September 12th. It will be lots of fun.
So that'll be mostly outside, I assume?
I think so. The band will, well, not sure what, Sam's kind of working on that part, whether they'll be on the stage or what.
Yeah, outside.
They'll be outside. Okay.
We'll be able to be outside.
They preferred that when I asked.
So do they play in the patio or how did they set up the dance outside?
Yeah, there's a stage at the end.
Okay,
Sorry,
is the stage close to the river?
Yeah.
Right there.
Sorry, I said the bookmobile will be outside.
Yeah, maybe what you meant.
I think she just wants to make sure they're outside.
Don't worry, it inside.
It's a brewery.
You have really big. Make a note.
So let's hope for good weather. It's not 95 with 95% humidity. 72. 72 with the breeze up the river.
I
But it doesn't smell bad.
I feel the areas of it,
Yeah, from the north.
One of my favorite venues. I'll see you there.
Can you even imagine Iowa City, what it was like before Big Grove? It's like,
Oh, so good.
so many things are there now, you know, they're held there. And it's like the only place to go to lunch on a Monday. Everything else is closed.
Sunday brunch.
Except right now, the kitchen staff isn't working on Mondays, so
Oh,
try it this month.
oh, okay. All right, miscellaneous, I'm not quite sure what that is. Anybody want to, oh, is that
We wrote an article about it.
the articles? Communications, I guess, is that what that is? No, that's later on. I don't know what miscellaneous is.
There's an article.
Miscellaneous. Okay, my report, I don't really have anything. Tom's not here, but I appreciate his taking over last month. Quite a way to start being president, to be gone. Also, I appreciate Ellsworth and Kelly doing some of the legwork to figure out where we could possibly hold the board recognition dinner. It's just really complicated. And then when the numbers started going up, we did talk, and it just didn't seem at all fun to sit around with masks on while we have a dinner. It makes it hard to eat as well. Continuing education, we've all known that, we're supposed to be paying attention to some effort to enhance our understanding of what it means to be a board member. And Kelly's been very good about sending things out. One board person suggested that possibly there's like short takes for boards, and that possibly that are like 10 minutes, possibly maybe every second or third meeting, we could do that as a board during the meeting. I have to confess that I have tried and I cannot access them. So I'll be getting with you, because I don't want to recommend that we watch them without actually watching them first, just to make sure they're not terrible.
They're not terrible. They're a little outdated, but they're not terrible. I did review them before sending them off, so.
So that's,
It might be something to consider.
I would obviously open to other suggestions for continuing education. One wonderful way is to take part in the staff in service day, which I don't know what your plans are for this year, but they're incredibly good and incredibly informative. So I would suggest that if you have the time, that you consider taking advantage of that. And that's really all I have to say. Announcements from members. A few of you that there are here. No. Committee reports no.
Not yet.
And the communications are the articles in your packet. And then there's the consent agenda. Would I have a motion to approve the consent agenda?
Moved.
Second?
Second.
All in favor? And then looking at the agenda for next month. Looks like we have some policy reviews. So I assume there's going to be more to the circulation and library card policy. Okay,
I've assembled a crew and we're doing it for your pleasure next month.
okay. I thought that was a little bit too easy this time. Anyway, so everybody remember to go to Big Grove on the 12th. And with that, unless somebody has an objection, we'll adjourn the meeting.